Novel coronavirus or COVID-19 spreads mainly through respiratory droplets expelled by an infected person. There are three types of infected people. Symptomatic, those experiencing mild or severe symptoms of COVID-19 like cough, cold and fever. Pre-symptomatic, people in the early stage of infection and who will experience these symptoms at a later stage. Asymptomatic, those with no symptoms. This is where things get tricky. The World Health Organization, in its initial guidelines, said reports indicate that people with no symptoms can transmit the virus, although the degree of transmission wasn't clear. On June 8th, Dr. Maria Van Kerkhove, WHO's technical lead on COVID-19, said spread from asymptomatic people is rare. Numerous experts worldwide have warned otherwise, that such transmission is more frequent and likely explains why the pandemic has been so hard to contain. However, WHO epidemiologists maintain that this type of spread is not a driver of the pandemic and probably accounts for about 6% of the spread at most. Dr. Van Kerkhove now stressed that this observation was based on limited studies of clusters and their contact tracing conducted in a few countries. But it is hard to say if this is applicable globally. As per director of the WHO's Health Emergency Program, Dr. Michael Ryan, he was absolutely convinced asymptomatic transmission was occurring, and the question is how much. Large-scale testing in Wuhan has revealed 300 asymptomatic carriers from around 10 million residents. But personal belongings such as toothbrushes and masks and surfaces have shown negative test results. A total of 1,174 close contacts of 300 infected people have tested negative for coronavirus. Based on the above findings, experts deduce that Wuhan has reported no asymptomatic transmission so far. On the other hand, massive testing in Vietnam has found that asymptomatic people can spread the virus to others. To understand this, we need to look at the viral load or how much virus is in the person's system. Nasal swabs in these patients showed a lower level of viral RNA but were a source of infection for two other people. The pre-symptomatic transmission has important implications for track, trace and isolation measures as per Professor Babak Javed, an infectious diseases consultant at the University of Cambridge. A study had previously revealed that 24 to 48 hours before the visible onset of symptoms, people can be their most infectious. Some other experts pointed out that current evidence suggests that people with symptoms are at the highest risk. Meanwhile, the mystery of the silent spreaders, aka asymptomatic patients, remain. Studies suggest that up to 80% of those infected can be asymptomatic, but we can't know for sure for all countries and regions within them. Therefore, Wuhan pushed to get its entire population tested. Some US scientists believe that asymptomatic patients are the vulnerable point of the fight against the pandemic.